It's my feel-good breakfast show.
Welcome back. You are still live with Expresso as we move into our health matters on this Tuesday morning. Now, earlier this month, South Africa's Minister of Health, Dr. Zweli Mkhize, announced that the country had indeed entered a second wave of Covid-19 infections. There's been a major surge in cases in hotspots that have been identified as the Nelson Mandela Bay Metro, the Garden Route and the Sarah Baartman District. Now, a new variant of the Covid-19 virus has also been identified by genomics scientists here in the country, which is said to be driving the latest surge, but it is a complex matter. Our very trusted infectious diseases specialist and good friend, Dr. Emile Reid, is here to tell us all about this newest developments with regard to coronavirus. Do you have any questions at home? Dr. Reid is ready to answer any of them. Please give us a call right now, 021 110 552. We'll keep that number on screen. Please give us a call if you want to ask anything at this stage. I know you're a tome of all information, Doc. Welcome back. I know you've been through the ringer with this. You've had COVID-19, so you've had a first-hand experience of what it's like.
Correct.
But also working within the front lines within your own hospital, you've been able to kind of see in the cold face what's going on, and maybe that's a good place to start. What are conditions like in your hospital right now?
Graham, thanks for inviting me again to be here and speak to the viewers as well. Currently, things are horrible. It's atrocious. Our hospitals are packed with people suffering from COVID. Our ICUs are currently 100% capacity. So beds is a huge problem. But the other problem that also have developed, and what we expected, is that healthcare workers are becoming tired, they're fatigued, they're burnt out. Oh. And they deserve some kind of rest as well.
Is there an answer to that?
Well, the only answer is to actually stop this virus from spreading in its tracks. That's the only answer. And I mean, currently, COVID-19 is running riot in South Africa, and more so in the Western Cape. Up to yesterday, we had roughly about 3,000 hospitalizations in the Western Cape, 37,000 active cases, which is the #1 amount of active cases in the country, followed by KZN at 31,000, Gauteng, and then the Eastern Cape, roughly about 15,000 active cases. So in the Western Cape is where the surge is happening.
And now they said to be a version 2.0, the SARS-CoV-2 variant. What is that all about? Does that make you scared in any way? Because already, like you said, the health workers are to their brim, they're tired, and here's another variant coming along. What does that mean? Yes,
the new variant is actually called 501V2. It almost sounds like a jeans brand that we need to buy. And what it's all about, there's a big difference between a variant and a strain change.
Okay.
Obviously, if this was a strain that was changing, I mean, I would have been scared to the bones, because obviously a change of strain means that we have to go back to day one and start all over again. Okay. And as for all other viruses, even SARS-CoV-2 is evolving, and with the fact that this virus is allowed to evolve, this virus is allowed to be transmitted and spread, with every replication cycle, you actually develop mutations or variants. And that is how this one came about as well. And many variants exist as what we call quasi-species, which means that they infect or get transmitted, and then they die off if that particular individual sort of isolates and does not spread the virus further. But frequently we find that certain variants becomes the dominant strain because they are spread and because they are transmitted, and they become the so-called wild-type virus. And this is what we've seen with this specific variant, currently thought to be the driving force of the current surge. But as you said, it's a complex matter, and we're not sure whether behavioral changes of humans are also responsible.
Or maybe
for...
it's kind of a chicken and egg thing where the one fuels the other and vice versa.
Exactly.
How was this new variant actually discovered?
What happened was colleagues in the Eastern Cape were referring to the new cases as being epidemiologically different. So whereas with the first wave, we saw the elderly, people with comorbidities, diabetes, hypertension, being overweight, being affected, the current surge was characterized by younger people becoming sick, younger people with no comorbid illness ending up on a ventilator and in an ICU. And that was one of the first things that made people alert to the fact that there might be a new variant around. And subsequently what followed was that they made the association between the current surge with a new variant of SARS-CoV-2.
Okay, we're going to explore this a lot further this morning. We'd love to hear your questions as well. 021 110 5552. Dr. Reid is going to stick around. We are talking about the new variant of COVID-19 and the current second surge in cases.